My name is Tanya Bubler and I'm the Dean of the Faculty of Health Sciences at Simon Fraser University. I'm very sorry not to be able to speak to you in person, but like many at the current time, I'm working mainly from home. The current COVID-19 crisis highlights the need for trained professionals with expertise in population and public health. This includes epidemiologists and data modelers who are informing our responses. Many of our faculty and students are assisting with planning for the current pandemic and starting to think about the short and long-term social and health impacts of our global response.
As a biologist, it's kind of doing biology and science with heart for a real purpose and intent. And that leads me to really the favorite thing I love about the Faculty of Health Sciences, and that is that it's an inspiring place to be.
Perhaps more than any other faculty at SFU, the Faculty of Health Sciences, its faculty and students are engaged in a wide range of activities, located both local and global. So we work with downtown East Side communities, with villages in Sierra Leone, but we also work with Global Affairs Canada and the World Health Organization. So in this sense, we are truly engaged with the world.
So we've got world-class researchers. We've got Sabrina and Mark looking at HIV vaccines. We've got Ryan Allen working on air pollution, Bruce Lamphere working on lead, Ruth Laverne looking at healthcare systems. Really a huge number of researchers doing amazing work. And if you work really hard and are interested in doing research, you should have some opportunities to do it.
What I learned most from the Faculty of Health Sciences at SFU is that health is so much more than the medical model, that there are different dimensions of health, such as psychological perspectives and social perspectives that we should be aware of, and that health interventions should be much more than just a medication or medical procedure. It should be a combination of policy changes and interventions and behavioral changes as well.
My favorite thing about the Faculty of Health Sciences here at SFU is just how interdisciplinary it is. I've been able to learn about molecular mechanisms of disease and then look at population health, and I think that range in all of the different classes you're able to take really provides a well-rounded experience.
There are also so many different things you can try, such as research or work experience through co-op, or getting involved in student organizations through the SFU, which is our student union.
Some advice for new students would be that don't be scared. It can be overwhelming trying to figure out what courses to take. Just pursue your interests. When I started health sciences, I knew the field itself interested me, but I didn't exactly know where I wanted to go with it. But as I took courses that interested me, I learned about social determinants of health and other population level health interests that I realized that I do want to work in public health. So I did not know that before I got here. So I'm sure everyone will eventually figure out where to end up.
SFU has allowed me to grow in many ways, with academics as well as with extracurriculars, clubs, and co-op.
My experience in the Faculty of Health Sciences really evolved from the beginning to end of my degree, and overall it taught me to be comfortable with being uncomfortable.